We've got a really, really good hospital here, but there are certain things that the NHS can't fund, and that's what we're here for. And the basic thing is to make this really good hospital a great hospital.
The Bournemouth Hospital Charity raises funds to enhance patient care and treatment for anyone attending the Bournemouth Hospital and Christchurch hospitals. We also provide extra care and support for our staff, which is really important, and we help refurbish areas, we build new projects, we do anything that the NHS can't fund, really. That's what we're here to support. Each year we usually aim to raise around 2 million, and that depends on what we're fundraising for. So we fundraise for particular items. We go out to the staff and ask them what ideas they have, and then we go through a process of eliminating projects and identifying ones that are really, really good. And then we go out to the public and the community and ask them to support those. Last year we spent the money on ultrasound machine for our early pregnancy unit, a FibroScan to help detect liver health, and that's taken out by our staff into the community. We funded lots of things for men's health, women's health, and we've supported over 100 staff receive extra training, which at the end of the day helps our patients.
Since we have this equipment, it is very good. The imaging quality is excellent, and as anticipated, our interventions have gone down. We require less biopsies because we are able to see things more clearly, and we are sending less patients to the main department for another opinion or for better scanning.
Before we actually had the technology of FibroScan, the only way to actually assess whether there was scarring in the liver, which was to do a liver biopsy, which is an invasive procedure, which needs patients to come into hospital for a morning or an afternoon. Once we had FibroScan, we were able to assess liver fibrosis, liver scarring, without having to do a biopsy. So getting the portable scanner meant that we could assess patients, scan them in community clinics, in the prisons that I work in. So it's a very useful bit of kit, but mainly it means that we can assess people quickly and they're more likely to engage with us because we're able to scan them in their local area rather than them having to travel.
So this area we're sat in is part of the Orchard Garden, which we fundraised for over the last 2 to 3 years. And it was the culmination of the Jigsaw buildings and makes a wonderful area for patients, visitors, staff. We all love to come and sit out here. It's a great facility. It doesn't even feel like a hospital when you're sat here. Well, at the moment we're fundraising for a mini MRI scanner, which will help reduce waiting lists and will be much more comfortable for patients who only need to have a limb scanned. We're also fundraising to improve some areas within the hospital, and one of those is our entrance to the theatres, which people walk down on their way to an operation most of the time, and it can be quite intimidating and scary. So we want to make that much nicer environment so it's more welcoming and people don't see bits of equipment and things like that and have pictures on the walls. So that's another area that we're fundraising for. And then lots of equipment, state-of-the-art equipment that really enhance patient care and treatment and help to make the Royal Bournemouth Hospital a fantastic place to receive treatment and care.
Hello, my name is Karen Smith and I'm the Senior Events and Challenge Fundraiser at Bournemouth Hospital Charity. Twilight Walk for Women is a fantastic fun event. The Bournemouth seafront becomes a sea of pink. We have fantastic band. It brings the local community to say thank you really for the care and support they've received at Bournemouth Hospital. And what makes it special is the fact that patients can take part in a fun event, and then the funds that we receive fund new and innovative projects that make a difference to future patients.
Supporting the hospital charity, you can be really confident in knowing that your support helps so many people. You know, none of us know when we might need to come here and receive treatment, and you know, every one of us could benefit from that, and I think that's the beauty of supporting the hospital. We're supporting so many people and supporting NHS staff at the end of the day, which is great.